In the country's race to reduce the significant burden of cancer, the government is now on course to enhance the quality of life for cancer patients. Speaking while visiting patients with terminal illnesses at Kenyatta National Hospital today, Health Principal Secretary Harry Kimutai affirmed that the ministry had already laid down plans to address the challenge of the treatment and diagnosis of the disease.
We have initiated, together with other hospitals, both private and public, we want to do what's called the pool procurement for cancer drugs in the country. We've already talked with the KEMSA, and currently already other private companies have come to support. I'll mention one specifically, Roche, whom we have had a discussion and a program where they have reduced the cancer drugs and other consumables by about 61%. And that will go a long way in easing the burden of treating cancer in the country.
According to the PS, the ministry will start by decongesting major hospitals through the addition of hospital beds. He says starting next month, the Ministry of Health will formulate a cancer policy that will support cancer treatment in the country through initiating the procurement of cancer drugs through its collaboration with KEMSA.
I know one of our units, the burns unit, and pediatric and burns unit, we want to fast track it so that it's able to be completed within the period to provide more additional accommodation of about 89 or 90 beds to decongest the current facility.
Additionally, he says the training of medical doctors in cancer specialty was already underway with the help of Moi Teaching and Referral Hospital, paying special emphasis on nurses to cope with the challenge of rising cancer patients.
As a country, we'll be able to expand our training facilities, train more cancer oncologists, especially the nurses, so that they are able to cope with the challenges, with the number of cancer cases that are increasing in the country. So that's what you're doing, and we're also providing more scholarships for our doctors so that they become the focal person, the people who will be able to now lead cancer in cancer treatment.
Elsewhere, the Kenya Association of Nurses is now demanding involvement in decision-making platforms within the government. Led by the chair, Seth Panyako, the union is calling on the Attorney General to retract his statements on the eligibility of the heads of institutions while in Parliament earlier this month. Gertrude Burgay, K24, Nairobi.